Magnesium is an essential mineral that has many important roles that are vital for our bodies to function properly. It is an indispensable ingredient for over 300 chemical reactions that occur in our body. However, did you know that magnesium deficiency is a common condition worldwide? This is understandable because the symptoms indicating magnesium deficiency can be a bit unusual. This is why in this video we will reveal to you 12 weird signs of magnesium deficiency. We suggest you watch until the end of this video because magnesium deficiency isn't identified by a single sign, but a collection of the signs we'll talk about in a second. Now, without any further ado, let's get to it. Number 1. Muscle twitches and cramps. Magnesium has an important role in controlling muscle contraction. When a muscle contracts, calcium ions flood into the muscle cells, which stimulate contraction. After that, magnesium counterbalances this contraction by pumping calcium out of the cells, allowing the muscle to relax. Without sufficient magnesium, this balance is disrupted, leading to excessive calcium accumulation in muscle cells. The result is prolonged contraction and muscle spasms. Number 2. High blood pressure. If you have been suffering from chronic high blood pressure, have you ever considered that you may have low levels of magnesium? That's right. Magnesium deficiency can cause high blood pressure. Normally, magnesium allows the relaxation of muscle in the walls of your blood vessels. Consequently, the lumen of your blood vessels widens and blood flows at a lower pressure. On the other hand, low magnesium levels cause the muscles in the wall of your blood vessels to contract more. The result is narrower blood vessels with blood flowing at a higher pressure inside. Number 3. Personality changes. This might seem like an extreme symptom, but this is why magnesium deficiency is no joke. Magnesium is involved in regulating the hypothalamic pituitary adrenal axis, through which the body's response to stress is controlled. Low levels of magnesium correlate with high levels of the stress hormone cortisol due to disturbances in the hypothalamic pituitary adrenal axis. This can make the person more anxious and easily irritable. A study in the Journal of the American Board of Family Medicine found that magnesium supplementation improved mood in 42% of elderly patients with magnesium deficiency. Number 4. Sleep issues. In the brain, magnesium facilitates the binding of gamma-aminobutyric acid to its receptors. When the binding of gamma-aminobutyric acid to its specific receptor happens, it promotes relaxation and reduces the electrical impulses fired along your nerves. In other words, it calms your brain, which is vital to induce sleep. Furthermore, magnesium is needed to form and release melatonin, also known as the sleep hormone. Typically, the darkness of the evening causes a gradual rise in melatonin levels. This signals to the body that it's time to sleep. For these reasons, low levels of magnesium can make it harder to fall asleep or to stay asleep. So, if sleep is something you've been struggling with lately, check your magnesium blood levels and take magnesium supplements if needed. Studies have reported significant improvements in sleep quality after following up individuals who were given magnesium supplements. Some trials showed up to a 50% improvement in sleep parameters for these individuals. Number 5. Numbness and tingling. Magnesium is essential for maintaining proper nerve function and transmission of electricity between them. It plays a crucial role in regulating the flow of calcium and potassium ions across nerve cell membranes, which is necessary for generating nerve impulses. Not only that, but magnesium also helps regulate the release of neurotransmitters such as acetylcholine. This neurotransmitter is responsible for muscle contraction and movement by communicating the impulses from the nerves to the muscles. Without sufficient magnesium, there's impaired nerve-muscle communication. This manifests as a sensation of numbness and tingling in the muscles. Number 6. Migraines. Unfortunately, suffering from migraines is a dreaded symptom of low magnesium levels. Unlike other types of headaches, migraines are described as a throbbing and pulsating head pain on one side of your head. Magnesium acts as an N-methyl D-aspartate receptor antagonist. N-methyl-D-aspartate is a neurotransmitter responsible for pain transmission. By acting as a receptor antagonist, magnesium decreases the effect of this neurotransmitter. However, magnesium deficiency leads to hyperactivation of N-methyl-D-aspartate receptors, causing an increase in the activity of nerve cells in the brain and pain transmission. Through this mechanism, magnesium deficiency contributes to the pain associated with migraine headaches. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 7. Fatigue and muscle weakness. The processes of energy synthesis and utilization require magnesium to be conducted efficiently. The energy currency inside your body is adenosine triphosphate, or ATP for short. To synthesize ATP, the responsible enzyme, which is the ATPase enzyme, requires magnesium as a helping molecule to function properly. In addition to that, even after ATP is formed, magnesium is still needed. Without the binding of ATP to magnesium, ATP is useless. ATP must bind to a magnesium ion for it to be usable by your body cells. Logically, without adequate magnesium, ATP levels decrease, which reduces the energy available to cells. This causes general fatigue in your whole body. And since your muscles are one of the most active tissues in your body and require tremendous energy, they're severely affected and weakened. Magnesium deficiency can lead to a 30% reduction in ATP production in muscle cells. Number 8. Mental disorders. Mental disorders can manifest as a result of chemical imbalances in your brain. These chemicals are known as neurotransmitters. For these neurotransmitters to be produced, magnesium needs to be available in adequate levels. Examples of these neurotransmitters include dopamine and serotonin. Dopamine is involved in reward and pleasure pathways, as well as body movements and mood regulation. Whereas serotonin is often referred to as the feel-good neurotransmitter because it regulates mood, anxiety, and happiness. Without magnesium, the production of these neurotransmitters will decrease, leading to mood disorders such as depression and anxiety. Number 9. Irregular heartbeats. Magnesium helps regulate the balance of other electrolytes, such as calcium, potassium, and sodium, which are critical for proper heart muscle function. The balance of these electrolytes is of great importance for regular heart contractions. A study was conducted that found that magnesium supplementation reduced the incidence of atrial fibrillation in patients undergoing heart surgery. In this study, patients receiving magnesium supplements experienced a 25% reduction in the incidence of atrial fibrillation after surgery compared to those who didn't receive supplements. Number 10. Nausea and vomiting. As we mentioned earlier in this video, magnesium is vital for regulating muscle contractions. This includes all your body muscles, including the muscles in your digestive tract, which involves your esophagus, stomach, and intestines. In the event of low magnesium levels, irregular prolonged muscle contractions and spasms occur in your digestive tract. This can cause nausea. Sometimes, food can even be pushed upwards, which induces vomiting. Number 11. Asthma. Asthma is difficulty breathing due to tightening of the airways. Being deficient in magnesium can exacerbate the symptoms of asthma. Lack of magnesium can lead to the tightening of muscles around your airways, which would narrow the air passage. Symptoms manifest as difficulty breathing, rapid rate of breathing, and wheezing sounds from the lungs. This is further proved by an analytic study which revealed that airflow in asthmatic patients improves by 8 to 12% when given magnesium supplements. Number 12. Osteoporosis. Osteoporosis is a disease where your bones become porous due to low bone mass and density. As a result, your bones become weaker with a higher probability of fracture. Low levels of magnesium can lead to osteoporosis because magnesium is an essential component of bone structure. About 60% of the body's magnesium is stored in bones, where it contributes to the formation of hydroxyapatite. Hydroxyapatite is a mineral compound that makes bones hard and strong. Research in animal models has shown that magnesium deficiency leads to bone loss. For example, a study on rats indicated that magnesium deficiency resulted in reduced bone mass and abnormal changes in bone structure. So these were the top 12 weird signs of magnesium deficiency. As unexpected as these signs may be, they can help you identify magnesium deficiency. Now, we want to hear from you. Have you or anyone you know been suffering from any of these signs? Was the cause magnesium deficiency? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.